Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. A study published in April 2023 in the Journal of Clinical Endocrinology and Metabolism showed that having a higher vitamin D blood level above 58 micromoles per liter, which is over 23.2 nanograms per milliliter, significantly reduces the risk of developing long COVID syndrome after the initial infection has been resolved. So having a higher blood level of vitamin D helps to protect against long COVID. So we've seen that. But in March of 2023, another important study involving long COVID was published in the Lancet journal. This study showed that compared to taking a placebo, if the patient is treated with the diabetic drug Metformin at the onset of mild to moderate COVID-19 infection symptoms, it reduces their risk of developing long COVID syndrome by up to 64%, provided they start taking the Metformin drug within the first 4 days of the symptoms. So in other words, if you start to develop COVID-19, you have mild to moderate symptoms, the study shows that taking the diabetic drug Metformin helps to prevent against developing long COVID. So the effective Metformin dose was 500 milligrams on the first day, 500 milligrams twice a day for the next 4 days, and then 500 milligrams in the morning and 1,000 milligrams in the evening for the remaining 9 days. So it's a total of 14 days of taking Metformin. The study was designed to test Metformin against the drug ivermectin, right, which is the anti-parasitic drug, which has become very popular among some groups as a potential treatment for COVID-19. It also tested Metformin against fluvoxamine, which is an antidepressant drug, which showed some promise against COVID-19 as well. So more specifically, between January 2021 and February 2022, researchers tested these 3 oral medications, Metformin, ivermectin, and fluvoxamine, in a clinical trial across the United States called the COVID Out trial. The people being studied, the investigators, the care providers, and others involved in the study were blinded to the randomized treatment, so nobody knew who was getting what. The trial was decentralized with no one person sort of in contact with the participants. This was a way to guard against any kind of bias that researchers or the patient might have. The researchers included patients who were aged 30 to 85, who were overweight or obese, had documentation of confirmed COVID-19 infection, had fewer than 7 days of symptoms, had no prior infection, and joined the study within 3 days of their positive COVID-19 test. The study included monthly follow-ups for 300 days. The results showed that Metformin treatment was effective in preventing long COVID-19 by 42 to 64%. The sooner the patient started on Metformin, the better the preventive effect. On the other hand, neither ivermectin or fluvoxamine showed any protective effect against the development of long COVID syndrome. So if you develop a COVID-19 infection, be sure that your blood level of vitamin D is above 58 micromoles per liter, or 23.2 nanograms per milliliter, and ask your doctor to start you on the drug Metformin using the dosing schedule that I've outlined in this report. These appear to be 2 really important ways to prevent long COVID syndrome and preventing it from evolving and becoming, these symptoms just linger forever that can be life-altering in a very negative way. So I've included the reference for this information in the text below. Thanks for watching, and I'll see you next time.